Well, my best friend died of complications related to HIV and AIDS in 1986. And my best friend was my father. So it was, a very difficult time because it was at the beginning of the epidemic. We were all scared, and we just really didn't know what to do. And one of my sisters said, "What are we going to tell people? What are we going to tell people? I don't want to say that he died of AIDS." And so in those first initial years, we told people that he died of cancer. So we really weren't honest about, what the true cause of his death was. Fast forward 10 years later to 1996, I found out that I was HIV positive. And at that point, I realized that it was important to talk about HIV and AIDS as a Black man so that I could help other people and I could be a voice for those that, were basically voiceless. So that's really the beginning of my journey with HIV. When I found about my HIV status, I was actually a volunteer with the Names Project AIDS Memorial Quilt. I had a wonderful support system around me living in San Francisco, being connected closely to the quilt, and having lots of friends around me. In 1996, when I converted, there were antiretrovirals and all types of other positive therapies to really help with HIV and AIDS. So I felt very confident that I was going to be able to live and live as I'd always lived. I did not tell my mother initially about my HIV status because my sister said that it might really upset her because she had lost her ex-husband to HIV and AIDS. But a few years after my diagnosis, again, I felt that it was important to share with her. And, at that time, she was very accepting. And she basically scolded me for not telling her sooner because she said that she loved me, the whole family loved me, and that I missed out on a lot, by keeping that in. A lesson that I've learned from my own experience is that it's really important for people living with HIV to come out about their status to their loved ones and their family and friends because they can be a tremendous support. And the longer you wait, the longer you lose out on having that opportunity for those people to support you. And if someone doesn't support you, go to those people and seek out those resources that can help you and will love you and support you because they're there. They're there. As a self-identified gay Black man living in a predominantly white community, when you add on HIV to the mix, it just adds one more challenge. Being open about it, for over 25 years now, as you try to have relationships with people, and if you're honest about your status, you oftentimes get rejection. But, you've heard rejection is God's protection. So I have no, really worries or fears around that. I'd rather be honest and authentic with who I am and all of me. And if somebody can't accept that, that's okay. I can move on. But it is challenging because there are a lot of issues that we as Black people face. And HIV is just one more thing that could make it more difficult. From the very early days of the HIV and AIDS epidemic, white men felt entitled. They needed their support, they needed their drugs, they needed their money, they needed so much. And I believe a lot of that is completely in line with just white privilege and white entitlement. Unfortunately, Black and brown people were becoming infected with the HIV virus at much more alarming rates than the white gay community, and the resources were not directed at them. Fast forward, a decade or two, the resources now are focused more on the communities that are most affected. So you are seeing more resources, you are seeing social marketing campaigns that feature Black and brown gay men and transgender men and women. And so there has been a positive tide in that regard. I think the shift to really a focus on Black and brown communities really started with us helping us, and that's Black people helping us. So organizations like the Black AIDS Institute, founded by Phil Wilson, really put a laser-like focus on Black people. You know, my father died of complications related to HIV. I actually had an opportunity to make a panel for the Names Project AIDS Memorial Quilt. And I did that with my sisters, my niece, and my aunt. And it was a very emotional time, but we felt that that would be a wonderful way to remember him and to honor him. I first became involved with the Names Project in the mid-1990s. A friend of mine was on the board of directors of the Quilt, and he felt that I would be a great addition to the board of directors. So I thought about it, and very quickly I realized that, you know, I could be a face and a voice around HIV and AIDS that you rarely would see. You weren't seeing in the advertising, you weren't seeing it on TV, so that was really my primary reason for getting involved with the Quilt. In 1998, I was awarded a social service leave from Xerox, the company that I worked for an entire year. And that year, I worked with the Quilt, and specifically the National High School Quilt Program. My primary goal was to take the quilt to communities of color, high school students, junior high school students. So I worked specifically with health people within the different school districts to go into those schools, bring in panels to really augment their educational programs around HIV and AIDS. I was fortunate enough to hand select panels, and often I would take my father's panel with me so that as I told my story, people could actually see and hear from someone living with HIV who had lost a parent to HIV. I did notice regional differences as I traveled with the Quilt around the country. Metropolitan areas seem to be very open and welcoming of the Quilt, of talk around HIV and AIDS, but there were definitely some challenges in many of the rural communities in Georgia, in Mississippi, Florida. So my approach in those different areas in talking to people and working with the different health administrators within those districts was sometimes a little bit more challenging. There were certain things I could and couldn't say. At one point, I was in Lochapoka, Alabama, and I asked a group of students if they knew anyone living with HIV first. No one raised their hands. And I said, well, you can all raise your hands now because I'm living with HIV. And you can't tell who has HIV or not based on how they look. So that's one thing. The second question I asked them was, do you know anybody that's died of complications related to AIDS? And I'll never forget that a third grade student raised her hand and said, my grandmother died of AIDS. And so that was surprising. But I was also happy that at least the child knew that her family and her grandmother had been afflicted by this disease, because that meant that people were talking about it in her family. So as I started to travel, I realized that a lot of families were talking about HIV, and that was a wonderful preventive tool so that other people could keep themselves safe.